I'm on my way to the dog park with our pup, and I was really thinking about some education that I did last week, and that was on strokes and what strokes actually do to the brain. It's one of my favorite analogies when I think about education with patients and families, with what actually occurs in the brain during a stroke that helps people to understand and make sense of what that looks like. So I wanted to share it with you because it's been something that's really been on my mind. That analogy is this. When we think about a stroke, whether it's ischemic, so from a blockage, or hemorrhagic from a bleed, I like to think about the brain kind of as a country's highway system or a country's infrastructure system. In the United States, where I live, the US infrastructure system or the US highway system is really, really comprehensive. And what I mean by that is you have, 6 to 8 lane interstates. You also have 4 lane, really major highways. Then you go down to 2 lane county highways, sometimes down to gravel roads, and then sometimes down to dirt paths. When we're thinking about a stroke is essentially an area of damage in the brain. With an ischemic stroke, that area of damage is due to oxygen deprivation or lack of oxygen getting to that area, versus with a hemorrhagic stroke or a bleed, that damage happens because blood is toxic to blood tissue. That's a simplified version of saying that, but generally that's kind of the general overview of what's happening. When that area of damage occurs, a good way to think about it is like there is a big old construction zone over the top of that area of damage. So that section of highway is cut off. So those neural pathways or those neural networks are similar to a highway system. When that happens, we can't get through it, and we have to take a detour around where that damage occurred. That's a really good way to think about why therapy is so important after a stroke. We are trying to figure out the detour. We're trying to figure out the reroute. And the brain has to work really hard to do that. So just like if you have a construction zone that's unexpected when you're traveling, just like any patient or family member might as well, understanding the detour and getting comfortable with that detour can be really confusing and really frustrating, and it can be a really slow process. Sometimes a detour is really straightforward. Maybe we just go around the construction zone on some major highways or some major roadways. But sometimes a detour is really confusing, where it's, to a county highway, then a 2 lane road, then a gravel pathway, then a dirt road, and then we loop back around. That's sometimes how healing and post-stroke progression can look. Sometimes it's extremely confusing and it's slow going. Comparing that to someone traveling on a dirt path or having to go around a really complicated detour is a good way to explain that and is a really nice analogy to families. I hope it's helpful. It's one of my favorite analogies, and I hope it's helpful for you guys too. Thanks.